I want to thank you all for joining us for our presentation today, where we're going to dive into some of the basic information about the Maternal, Child, and Adolescent Health Master of Public Health Program. We'll provide you with a brief overview of the MCH program. We'll review a little bit about our program curriculum, and we'll give you an overview of our program costs. And after we've covered these topics, if we have any time for questions, you can feel free to send them in. So before we dive into our presentation, allow me to introduce myself. My name is Kevin Guzman, and I am the Admissions and Recruitment Coordinator for the MCH program here at Berkeley Public Health. Now, as the Admissions and Recruitment Coordinator for MCH, I can answer any questions that prospective students might have regarding our MCH programs. I advise our prospective students on a variety of different topics and ensure that all of your questions are addressed. I'm also a Berkeley alumnus, so I know how exciting and daunting it can be navigating such a large public research university, but that's precisely why I'm here, to help support our students. Now, with all of that being said, let's just dive right in. So first and foremost, let's begin with a bit of context for our MCH programs. The Community Health Sciences, or CHS division, is home to 3 MPH programs that include Maternal, Child, and Adolescent Health, along with the Food and Nutrition and Population Health and Health and Social Behavior programs. In addition to our academic programs offered here, CHS is also home to the MCH federal training grants that are administered by the HRSA's Maternal and Child Health Bureau, which includes the Center of Excellence at MCAH. In a nutshell, each of these training grants are designed to provide specialized training in the area of maternal, child, and adolescent health. So diving deeper into the mission of our program, the MCAH program has been providing graduate training, education, research, and service for over 70 years. With more than 1,200 alumni globally, our goal is to develop leaders who will address public health challenges facing women, children, adolescents, and families today. We also pride ourselves in providing an interdisciplinary curriculum and a dynamic learning environment focused on emerging issues and the needs of our diverse communities, all while promoting health and racial equity. Now, when it comes to our programming, MCAH offers the same quality program in a few different tracks to meet the different needs of our differing student populations. So starting off with our 11-month program, this track condenses a 2-year program into a fast-paced 11 months and is geared towards students who already have an advanced degree or current medical students. For students without an advanced degree, we also have our 2-year MCH program, which is designed for students who have completed their undergraduate degree and are looking to add an MCAH MPH to their belt. We also have a 4+1 program, which is specifically designed for UC Berkeley public health undergraduate majors and alumni who have graduated from 2017 onward. And then lastly, we do offer a 3-year concurrent degree in social welfare and public health, or the MSW MPH, for students who are interested in combining the epidemiological approach from public health with a biopsychosocial approach from social work. However, students will apply through the School of Social Welfare, and that is out of the scope of this presentation. Now, regardless of which program you are applying to, there are a few MCAH MPH requirements that all students, regardless of their concentration, need to satisfy. Naturally, these students will have to take courses in epidemiology and biostatistics, but they will also be required to take breadth courses in health and social behavior, environmental health science, and health policy and management. Not only does this ensure that our students have a well-rounded understanding of maternal, child, and adolescent health, but it also emphasizes the interdisciplinary nature of our program, in which students will be taking courses throughout the School of Public Health. Now, lastly, we want to also mention that leadership is another core component designed to form our graduates into public health change makers. Now, diving into our MCAH curriculum, we want to briefly talk about our MCAH core courses, Central to our programs are our Foundations of MCH Policy, Practice, and Science course, the MCH Journal course, and our Practicum in MCH Data 1 and 2. These courses provide a foundation for our students to develop their methods of measurement and analysis for their capstone projects, as well as to develop the applied programmatic skills, which are core to building our students into confident public health leaders. Turning our attention to the MCH Capstone Research Project, this is a major milestone of the MCH program, which consists of both written and oral components and is considered to be the comprehensive examination for MCH students. The MCH Capstone is a quantitative research project that is completed over the course of 2 semesters and stands in lieu of a thesis. Furthermore, we want to emphasize that the Capstone Research Project will specifically require the use of quantitative research methods. As a result, successful applicants will have strong competencies in quantitative research methods in order to be successful in the program. However, regardless of what students' quantitative skills are, our MCH Capstone seminars are designed to support our students in the development of their capstone project. Now, the goal of the Capstone Research Project is to demonstrate that students have mastered the necessary skills to complete an in-depth, quantitatively based research project. The projects are designed to ensure that students will reach an in-depth understanding of and familiarity with specific MCH topics that are relevant to their career goals and interests. In order to demonstrate proficiency in their chosen topic, students will conduct a research and submit a written paper and give a final presentation on their research findings to their MCH peers and faculty. Now, lastly, we want to also mention that for our 2-year 4+1 and MSW MPH students, there is a required practicum component, which allows students to apply public health skills and concepts outside of the classroom setting. As a side note, given the short-term nature of their program, students in the 11-month MCH program will complete an applied practicum experience through an alternative requirement. For example, this is a project for a community-based organization within a service learning course. Now, the practicum experience is organized by our RISE office here at Berkeley Public Health and our MCH preceptor. Prospective students will often ask if they need to have an organization in mind before they start the practicum, and the answer to that is no, since our RISE team will work closely with all of our students and pair them with the right organization that suits their interests. Now, to give you all a sense of where our students have done their practica, we've included a short list of just a few of them here. And as you can see, many of these organizations are local to the Bay Area, which highlights our school's commitment to serving the public good through service learning. Now, I can imagine what you all might be thinking right now. This all sounds great and I'm interested in applying, but how much does it cost? Well, we completely understand these concerns, and that is why we want to be transparent about the overall cost of our programs. Now, as you can see from this table, the total cost for the 11-month MCH MPH is just over $38,000 for California residents and a little under $50,000 for non-residents. This includes international students and out-of-state students. Now, something I want to point out here is that the figures in bold are semester totals, and we arrive at the total cost by adding the summer session total, new MPH student total, and continuing student totals, and this reflects the cost of the 3 terms that comprise the 11-month program. The 4+1 program cost is roughly similar to the 11-month program. However, with regards to the 2-year program, the total cost is a little over $66,000 for residents and just under $91,000 for our non-resident students. Once again, these total costs are calculated based on adding the new MPH student total plus the sum of 3 times the continuing student total, thereby giving us the total cost of 4 semesters that comprise our 2-year program. Now, please note that tuition and fees are subject to change year to year, and some of our out-of-state students may qualify to pay in-state tuition once they've earned California residency. But we're sharing this information to give you all just a rough idea of what the total cost of attendance will be for our programs. And because we recognize that earning your graduate degree is an investment, we also want to note that our program costs are more affordable than our peer institutions. Now, when it comes to funding your education, we do also want to quickly mention that because this is a professional degree program, students are expected to self-fund their education through a combination of personal savings, student loans, and extramural scholarships. That being said, our program has a very modest budget to provide merit-based funding to qualified students, and we recommend that you refer to our admissions page to learn more about tips on how to fund your education. So thank you all for bearing with me, and this concludes my presentation.